I think the biggest change will be the direct communication from teachers directly to the health office staff. And we're asking teachers to call us to let us know that a student is having a need for a health office visit, so that we can direct them to either our main health office, depending on what the student's need is, or to the area identified for students who might be exhibiting some symptoms. Really important for us to have what we call kind of a non-sick area and an area for students who may have some symptoms that could be associated with even allergies, but could look like COVID, so that we're just maintaining that extra safety measure for our students. So a teacher will contact the health office to let us know that a student is having a need to visit, and our health office staff will meet the student at that identified location in each building to screen that student, to maintain a very safe environment for students. And we have a screening tool that we've used to put together with the guidance that came from the Iowa Department of Public Health, along with any specific screening points from Blackhawk County Public Health. And we will use that to screen the student and take the next best steps. So for students who have been screened for potential COVID symptoms, again, using our screening tool for consistency and the safest measures, if a student would have a symptom on that screening tool or a combination of those as indicated, then we will contact the parent or guardian that's identified in our electronic record to have them come and take the student home. We've also developed our screening tool so that the parent or guardian will receive a copy of that screening tool. They will know what symptoms were present. And then it also includes the steps of the number of days that that student will need to come or stay at home, if they should seek medical advice from their provider. We just felt that that was really important to give that information to the parent. A provider might want to know what symptoms they were exhibiting when they do an assessment, and to support the parents in knowing what their next steps are to care for their student. So one of the recommendations that a parent will see on the screening tool is to contact their medical provider, their student's medical provider. At that time, your provider will decide if your student needs to be seen, either a virtual visit or in person, and a provider may order COVID testing for your student. Then you would follow that process to the location as that's ordered by the provider, and then wait for test results. Now, there is a different process if your student tests negative for COVID. And moving forward, again, we wanted parents to have that information to know what steps to take, so that's all included on that screening tool. And parents, again, will receive a copy of that screening tool when they pick up their student if they do exhibit symptoms and need to leave school. I've been personally involved with the Return to Learn Health and Safety Committee with the district over the summer. I have every confidence in the steps that the district has taken in putting the right people in that committee, and the time and effort that we have put into that. I feel that we have a successful plan following the resources that all of us are asked to use on a regular basis. The CDC, the Iowa Department of Public Health, the Iowa Department of Education, and our local county public health has all been considered. Blackhawk County has also been a part of that committee to be sure that we're moving in the right direction as we've established plans. And I have every confidence in the plan that we have, and we will continue to make adjustments in that plan as needed to best serve the students, their families, and the staff of the district, and how that all flows out to our community.